fine, and we are happy about that. And with that, I thank you for your attention. Oh, wow, 0, 0, 0, 0. In time, like as we like it in Switzerland, honestly. Thank you.
Sara Cazzaniga מאיטליהפארמאקו על ג'ינג'יבוסטט בדושן ובקר.
Okay, so I want to thank you very much, Litostep and Tali, for this invitation. It's a really pleasure to share with you all the data that we have so far for Givinostat and discuss with you the development of Givinostat in Becker and Duchenne muscular dystrophy. So this is just a disclaimer. So I'm an employee of ItalfarmacoSpA. Givinostat is not on the market, and this presentation is just for education. So this is my agenda. So I want to talk to you about the role of Givinostat in Duchenne and Becker muscular dystrophy, and then show you the preclinical and clinical data that we have so far, and finally showing you the trial that are ongoing. So Givinostat is an histone deacetylase inhibitor, an HDAC inhibitor. What does it mean? It means that Givinostat maintains the histone of the DNA more acetylated, and that's and the meaning of that is that there is an increase of the DNA transcription. So we have already treated more than 500 subjects, and that's in a different disease. But 31 were children with juvenile arthritis, and 20 were DMD children, and 8 of them were treated for more than 4 years. So as we had a huge number of patients treated with Givinostat, we know the safety profile of Givinostat. So Givinostat is well tolerated, but as all drugs have, there could be some adverse reactions. So the most important one are the platelet count reduction. So we have seen the reduction of platelet in a patient treated with the highest dose, not tolerated dose, and this event is asymptomatic and fully reversible. What does it mean? It means that after there is a reduction of the dose, or the dose is, or the drug is stopped, there is an increase of the level of platelet at the normal range in a couple of weeks. So it's a manageable situation. And then there is nausea, vomiting, abdominal pain, and diarrhea. Generally, they are mild or moderate, are transient, and usually this event appears at the beginning of the intake of Givinostat, so in the first months. So I want to show you this picture because I want to show you how Givinostat can work in this disease. So as you know, when there is a lack of dystrophin or a low amount or a dysfunctional dystrophin in muscle, that means that there is a repeated damage of the muscle fibers with a consequence with a chronic inflammation. And as you know, when there is a chronic inflammation, there is a decrease of muscle regeneration, as well as an increase of muscle fibrosis, fat displacement, and fibrosis. And if you look at this picture, at the end, how is the muscle is? The muscle is like that, so less fibers and more fibrosis. So where Givinostat work? So Givinostat, it's really very important to know that does not restore the dystrophin. So doesn't work on the dystrophin level, but Givinostat works at the downstream effect of lacking of dystrophin. So Givinostat works at 3 different levels. At the inflammation level, so Givinostat is an anti-inflammatory drugs, reduce the production of some pro-inflammatory cytokines in the muscle. Then Givinostat works at muscle regeneration, in fact, increase the transcription of some important gene that transcribe for protein, which are really very important for their regeneration. And one it's really very important is the follistatin. And finally, Givinostat has also an antifibrotic effect. So he works at these three different levels. So if we came back to the picture that I showed you before, so Givinostat can work at this level, so reducing the chronic inflammation, and that means Givinostat can increase the muscle regeneration and decrease the muscle fiber necrosis, the fatty replacement, and the fibrosis. So what we believe is that Givinostat could restore the muscle close to healthy muscle. Okay, so which are our preclinical data and our clinical data in Duchenne? So, as other companies show you, we made a study in MDX, a Duchenne mouse model, and we performed the histological evaluation. And what we have seen is that Givinostat increased the muscle fiber diameter, so the cross-sectional area of the fibers. Then we look at also at the fibrosis, and we notice that Givinostat decreased the fibrosis, and as well as decreased the inflammation, and finally there is an increase of resistance to fatigue. So that means there is an increase of functional in these mice. So having in mind and having this data, we decided to go ahead and to start our clinical study in Duchenne. As we had a previous experience in children, we didn't perform a phase 1 study, but we started with a phase 2 study in 2013. So the study objective of the phase 2 study, which the number is 43, but does not mean that we are an exon skipping of the 43 gene. That's just a number. I want to point it out because it's really very important. So the study objective was to replicate the preclinical histological finding in humans. So because we want to be sure that what we have seen in mice would be applicable also for humans, so for children. And so Givinostat, and also demonstrating that, we want also to demonstrate that Givinostat preserve muscle mass, and we evaluated that with the histological level. And of course, as you know, safety is really very important, so we also evaluate safety. And the study design, we enroll 20 patients, 20 children from 7 to less than 11 years, and they were treated for 12 months, and they perform a histology at the beginning, at the end, so a muscle biopsies. So here are the histology data. So as you can see here, each bar are each patient, so that means that there was an increase in all patients of the muscle fiber area fraction, which is the part of the histology slice where there is the fibers. So that there was an increase of muscle fiber area, but consequently there was also a decrease in fibrosis, necrosis, and fatty replacements. So now these patients are still on treatment, and we continue the treatment. So these are the data after 12 months of treatment, and these are just a picture to show you the biopsy at the beginning and the biopsy after 12 months of treatment. So now these patients are still in treatment, and if you look at the data after 48 months, so after 4 years of treatment, we have 4 patients who lose the ambulation. But as we didn't include any placebo-controlled patient in our study, we could not compare with the placebo patient. So we are still working to identify an external control to compare the data, our data, with the natural history data. And just to show you, these are very few data on the pulmonary function test. And what we have seen is that also the FVC and the PEF are still stable after 4 years of treatment. So next study. So we plan a phase 3 trial after we met both the European agency and the FDA, And so we discuss with them the study design, as well as we discuss also with some patient advocacy group and also with some no-profit association in Duchenne. So our phase 3 trial, the name is APDIS trial, and the study objective is to demonstrate that Givinostat preserves muscle mass and slow down the disease. And we want to see that using the functional test as well as the MRI. That's because we have data on a little piece of muscle, but we want also to see the data, the imaging data in the whole muscle. Which are the inclusion-exclusion criteria? We do not have any genetic restriction. That's because Givinostat can be used in all boys. The patient has to be at least 6 years old, and the patient has to be in stable steroid for 6 months, and the patient has to be able to perform the Foster's climb in less than 8 seconds, and has to come back to time to stand up from the floor in less than 10 seconds. And of course, the patient has to not have any contraindication to perform the MRI. So the study is a double-blind placebo-controlled study. So that means among 3 patients enrolled, 3 children enrolled in the trial, 2 will receive Givinostat and 1 will receive placebo. And the study duration is 18 months. And at the end of 18 months, this is really very important because we have already planned and already opened the long-term safety trial. That means we will ask the parents and the family if they want to continue the treatment in this trial, and this trial will be open until we will have the approval. Okay, so what does a family and a patient do if they decided to be enrolled in our trial? Of course, they have to sign the informed consent, and the clinical visits are in total 15, and the clinical visits are every 3 months, but it's really very important to notice that at the beginning there are more frequent visits. That means in the first month, weekly, in the second month, every 2 weeks, and the third month, and then every 3 months. That's because we want to look at the platelet of your boys, because this is really very important. We don't want to see any decrease of platelet, or in case there will be, we reduce the dose to your children. So every 3 months there will be also the muscle test, and the pulmonary function test will be evaluated at baseline, 12 and 18 months. And as I told you before, there is also an MRI exam, so the patient has to scan at the beginning and at the 12 and 18 months. Okay, Givinostat is an oral suspension, has to be taken twice daily. In effect, that means after breakfast and after dinner. And we will reimburse the expenses that you will incur to achieve the clinical visit. We have also a family support patient travel agency, and in some cases the patient could be also perform some blood tests at home, because we have also a study nurse who can reach you at home. And as I told you before, if the patient will complete the study, the patient can be treated in a long-term safety study. These are our sites, so US, Canada, and some European countries. The study is still ongoing. We have recruited, today 50 patients, and we are looking for 2 Israeli sites. We want to open these sites before the end of this year. And then finally, we have also a phase 2 trial in Becker. So as Givinostat have a different mechanism of action than the drug who restore the dystrophy, Givinostat can be used also in Becker patients. So we decided to perform a trial in adult patients. That's because we want to see the biopsy, so the result of the histology. And this trial is ongoing in Italy and in Netherlands. And the objective is the same of the previous phase 2 study in Duchenne. So what we want to see if the positive result that we had with the Duchenne patient will be the same in Becker patient. So the study is ongoing and we are recruiting patients there. And in that case, we want patients who are ambulant and are able to perform the 6-minute walk test between 200 and 45 meters. And that's it. Thank you very much.